start.
And then, hold on, let me grab something. Do you have today's nurse's note? Did I give it to you? I'm gonna leave it in here on the card. So, all right, here we go. All right. So you have 3 charts here. They're all the same. I just loaded 3 in case something got funny, okay? So, and it goes straight to your patient, but you might have to move this little, the bar up for each page, I noticed, to get to the top part with the name and stuff you want. All righty, Miss Ray Ellen.
Okay.
You are taking care of a patient. His name is Eric Thompson. He has no known allergies. He's post-op day 5. He should go home this evening, as long as he doesn't have any complications today. He says he's feeling good today, and he's been afebrile. Yesterday he had an episode that only lasted 10 minutes, AFib, in the 120s, but he hasn't had anything since. So he's tolerating activity. We've been getting him up 4 or 5 times a day, ambulating him out to the podium and back. This morning he's already done 3 laps. His wounds are just covered light with gauze. They could be open to air, but he wants it covered with a little bit of gauze. Everything looked good for me this evening. He's been stable. He forgets to use his IS as often as I want, so I just kept reminding him. And so we're pretty much getting him ready for discharge.
Okay.
He, let's see, I think that's pretty much it. Do you have any questions on him?
How's his neuro?
Oh, he's alert oriented. No
Times-
problem. Times 4.
Times 4, okay.
Yep.
How about how's his O2 setting?
He's been in the 94s, 96s for me all evening.
And his blood pressures?
They've been great. He's been right around 124 over 74 was his last reading.
Okay, and his respiratory rate?
16.
16. Okay. And do you know his code status?
He is full code.
Full code.
Mm-hmm. Yeah, he's a young guy.
Full
Well,
code.
fairly young.
He's not on any isolation?
Nope, no isolation.
Okay.
Standard precautions.
Has he had any edema in his lower extremities?
No,
Have you seen any?
no, maybe just a tad, but nothing extreme. Very mild
Okay.
edema
And you
around
said
the
he's-
incision. He has pain. Last time he was medicated, I believe was Percocet, and he got that at, well, let's see, what time was that? He got that at 2400.
Okay.
So he should be waking up for you, probably have a little pain, I'm not sure.
Okay.
All right.
And do you know for his incision or for his procedure, did he have the cabbage where they take it from his leg vein?
Yes, they did.
Okay, so
Yes,
he
they did.
also has the incision on his leg.
Yes.
Okay, and has that been?
Yeah, been
clean?
fine.
Okay.
Yep, been fine. Actually, I had a student nurse last night that did the dressing for me.
Okay.
So.
Let's see. Does his incision? I mean, not his incisions. His IVs. Does he have an IV in?
He does not right now because
not
he was
have an IV?
up for a lap in the hall. So.
But does he have at least a catheter?
Yeah, I've been flushing it. It flushes well,
Okay.
and we've had it running at 50.
50.
So, yeah, just KBO, you know? And so you may want to pick it back up if you have to give him any IV meds, but he
What-
hasn't really needed it
When did they? Do you know when they put the IV in?
during surgery.
Okay. So 5 days ago.
Yeah. I think it's a 20 gauge in his right arm, AC.
He doesn't have any labs or anything due today?
No, nothing for me. Nothing. They already drew them for you.
Okay. He doesn't have any drains in or anything?
Nope, no drains.
Okay. special discharge planning I should know?
Nope. Nope, just standard discharge. Can I use your pen real quick to sign
Yes.
something off?
A little baby
Ooh.
pen.
All right, there you go.
Thank you.
That's just gonna keep making noise for you, and I'm pretty sure you don't want that.
We heard it going off. Someone's like, "There's a IV pump going off."
All righty, my dear. I'm gonna take off. I gotta get my kids to school.
Okay,
All
sounds
right.
good. Have a good night
You
or
too.
day.
Oh, yeah. I'm gonna go to bed. Thanks.
Okay, thank you. All right, is there? Wash my hands.
You can go ahead and get started.
Okay. All right. Okay, Mr. Eric Johnson.
Come on in.
Hello, my name is Ray. I'm gonna be your nurse for today. I'm just gonna close this.
Ray, that's a boy's name.
Well, it's Ray Ellen, so I guess you could say it's more of a girl name.
That's-
Spelled differently as well.
I like it.
Thank you. All right, could you tell me your name and date of birth for me, sir?
Sure, Eric Thompson, XXXX.
Okay. All right, and I see here, do you have any allergies that I should know of to food, the environment, or to medication?
No,
Let me just see this. All right, so I see that here, and you don't have any allergies in here either. All right, do you have any pain that I should know of right now off the bat, on a scale from 0 to 10, 0 being no pain at all, 10 being the worst pain?
well, when I'm laying still, the pain is about a 3.
About a 3, okay, and do you know where the pain is located?
No, yeah, it's on my chest.
On your chest, okay.
Sometimes my leg hurts.
Sometimes your leg hurts, okay. Is it okay if I sit you up just a little bit?
Sure.
Okay. Alright, and I'll go ahead and listen to your lungs here, and I'll look at your heart, see where it's hurting. Alright. Other than that, you're feeling okay?
Yeah,
You don't have any shortness of breath or feel like you can't catch your breath?
no.
Alright, let me go ahead and look here. Actually, let me take a look first. Can I open this?
Oh, yeah.
Okay. Alright, I'm just gonna look at your incision here, okay?
Okay.
Okay. So I see it doesn't have any redness on it. Let me get some gloves real quick. Doesn't have any redness. Does it feel like it's stinging when you move, or is it just like a dull pain?
Maybe a little bit of both what you just said.
Okay.
It burns.
It just burns a little bit
Well, and it hurts when I'm moving.
when you're moving?
Yeah, like the muscles in my chest.
Okay, so that might have happened as well, because whenever they go in to do the heart procedure, they have to sometimes pull on the muscles a little bit, so you might feel a little sore. Can I touch around it?
Yes.
Okay, I'm just gonna be feeling around to feel any warmth or anything. Make sure it's not. Is it hurting anywhere I'm pushing here?
Little, yeah.
A little bit? Not too much that it make you scream or anything?
No,
Okay.
no.
Alright. Well, I don't feel any warmth, so that's a good sign. It looks like it's well approximated, so that means it's closed well. There's nothing opening up to me. There's no redness on it, so it looks good to me, okay?
Okay.
Alright. Oh. I'm gonna take my gloves off. Is there a trash can? No trash can. Well, let me look at your leg one too. I took my gloves off. Alright. I can go ahead and do your lung sounds while I'm here. pulses for just a little bit here. This band's not really tight. Okay. I'm gonna cover you up here. I'm gonna keep you exposed. Okay, well your lung sounds sound pretty clear to me. On the front. And I see your incision here. On this side. Am I supposed to see an incision? Okay, well, I'm going to assume it looks good. Oh, here it is. Okay. So this is a little soaked here, sir.
That hurts where you're touching.
It hurts where I'm touching right now?
Yes.
Right around it? Okay.
It's really like throbbing.
Throbbing? Okay, that's it though? It doesn't, when I push on it, it hurts a lot more?
Oh, yeah.
Okay. So I see here there's a little bit of drainage here. So we'll definitely have to take a look. Do we have any dressing change here? Alright, let me see in my computer what we can do. Would you like, let's see, last time you got at a 2400.
There's tabs on the bottom to go through the chart.
Oh, okay, thank you. Twice a day. Okay. So do you feel like you have enough pain every 4 to 6 hours? Let me see, so 2400. It's 8 o'clock. Do you feel like you need a pain pill for your knee? Because I'm gonna go ahead and take a look at it and change the dressing on it.
Okay, that'd be great.
Okay, sounds good.
What do you think that drainage is?
I think it could be. It depends. I'm gonna look at it further. It could be just some drainage, like some blood off of it, but it could be that it could be infected. So I'll go ahead and take a further look once I have dressing change stuff. Can I look through this? No, probably not. Okay. All right. Let me look a little bit further on it. Okay, I'm just gonna peel off the little sticky stuff here. Okay. Well, I don't see any drainage on the actual wound itself. Does it hurt when I push here?
It does.
It does, okay.
Yeah. Yeah.
Yep.
Is there some way that you can find out what that is?
Not necessarily from the drainage itself, but we can keep taking a look at it. We might do, I don't know that really a culture on this would do anything, but we'll definitely take a look. If it's warm, I don't feel any warmth, but if it's warm, that's a sign of inflammation. It doesn't look too swollen to me either, so we'll just keep monitoring it. We'll see if you have a temperature, make sure you don't, just to make sure you don't have any kind of infection going on. I'll take a look at the charts to see if your white blood cell count is high. It could show that there could be a sign of infection as well. So I'll just keep monitoring it, okay?
Okay.
So, is there other dressing change? Can I just leave that there for now? Okay. So let me look at your lab results to see if I see anything, okay? Let me take a look at your feet too. I'll make sure your pulses are good. I'm taking off my gloves. Alright. Don't want to leave that feet. Alright. feel me touching your feet here?
Yes.
Okay. Alright. I'm trying to feel your pulses here. Probably keep it going. Okay. Your legs don't look like they're any kind of swollen. Do your feet feel like they're a little heavy or swollen?
When I'm walking around the unit.
When you're walking
Feels like
around?
I'm walking slow, but I think it's kind of, part of it's this medication they have me on.
Okay. Okay, that can happen sometimes. Full socks on? Somewhere? Somewhere? Are you sitting on your full socks? I don't know if that's as wired or not. Okay, let me just take a look at your IV here. Is this hurting your arm any at all?
No,
Okay.
I mean, only if you touch the needle thing that's in my arm.
Right. I'm gonna touch that. Alright, so let me see here. Let me look at your labs a little bit. Now I see. Okay. Okay, so your white blood cell count looks like it's in the range of being normal, so that's good. It's a good sign. Yep. Do you feel like you have a temperature? I know I heard from the other nurse that you might have had a little bit of one.
I don't know, she didn't say.
Okay. Thermometer. Okay, well, I'll just keep looking around to see if I can find anything, okay? Just trying to feel your pulses here. Alright. I'm gonna listen to your heart, okay? I know I listened to your lungs earlier, but let me listen to your heart. Just gonna open up this one.
Okay, Ray Ellen. Let's go ahead and have you turn your recording off.
Okay.
We're going to debrief.